Let's welcome in now Dr. Syra Madad, Senior Director of New York City's Health and Hospital System-wide Special Pathogens Program. Dr. Madad is also Principal Investigator with the Center for Global Healthcare Special Pathogens Preparedness and was recently featured in the Netflix docu-series Pandemic. Dr. Madad, thanks very much for joining us.
Thank you for having me.
When we see this big spike in reporting numbers middle of last week from China and since then coming down a little bit, does it make you think that we are past the worst of this, or can we not say that yet?
I think not at all. I think it's way too early to tell. And with this trend, I think we need to just take it with a grain of salt. We still are very early on in the outbreak, and I think that there's still a lot that we still don't know. There's still community transmission happening, not just in China, but in other countries around the world. So I think we're really close to a tipping point of this potentially being declared a pandemic event. So certainly, I think, in my opinion, it's probably going to get worse before it gets better.
Including places like the U.S.?
That's right. I think we're going to continue to see additional cases, perhaps even community transmission, according to what the CDC is stating. And this is why around the nation, hospitals and healthcare systems are basically, preparing for a worst-case scenario.
In terms of the cruise ship and how people were treated on that, do you support that U.S. citizens were brought home from it, or do you think they should have been kept on the cruise ship? On one level, it felt like almost a human rights abuse to keep all of those people together in that way.
So cruise ships are notorious for, obviously incubating a number of different infectious diseases, and we've seen that with norovirus. But I think that the decision that was made, obviously, is based more so on politics, perhaps less on science. And I think as this continues to evolve, we'll see if this was a right decision or not. But certainly right now, it seems that it was perhaps not a great decision, but I think we'll continue
Even if
to see.
they're kept in quarantine at an Air Force base or wherever that might be when they return home?
So, I think that social distancing is a very important aspect. It's a good public health measure. So certainly in that regard, I think it's a good way to obviously mitigate the issues that we're seeing.
Can you speak to the tails? So the best case, what would that look like? How long does it take to evolve, and what would you look for? And God forbid, the worst case.
So best case, in this, current, obviously, epidemic is that the virus, basically calms down, if you will, and we're able to get it under control, not just within China, but worldwide. It doesn't seem that that's going to be the case. This is a respiratory virus. Respiratory viruses are very hard to contain just by the nature of the virus itself. I think worst case scenario, it's going to continue to infect, susceptible individuals until we have a therapeutic or vaccine available.
So, Doctor, how virulent do you think that the virus actually is? The rates of mortality rates are very high, but they may not include all the people that we don't even know had it because they didn't get that sick.
That's right.
What is your feel for it? It's much lower than 1%, wouldn't you think?
That's right. So a large portion of the cases, over 80%, are mild cases. And I think for every individual that's actually going to the hospital, there's probably hundreds more that obviously do have the coronavirus disease, but they're not going to the hospital. So they're being counted in the case.
Is it higher mortality rate than the average flu? Or
it is higher, but it's lower than SARS and MERS, which is another coronavirus. So I think in that context, this is a mild virus, but again, too early to tell.
Just one more question. How did we how did SARS was a coronavirus? How did that peter out? Why you're saying it's unlikely it does this time? Was it harder person to person transmission? This is better. COVID-19 is better.
So coronavirus 19 seems like it's obviously acting a lot like seasonal flu, and it is much more transmissible. So we're seeing a lot more individuals obviously get infected compared to the SARS outbreak that we saw in 2002. But I think it's also important to highlight the number of people that have actually recovered from coronavirus disease. So over 13,000 individuals have recovered.
Are they fine immediately, or do they go through a 6-month period with heart and respiratory issues?
I think it's still too early to tell. I mean, we're only 6 weeks in, so I think that they're still following these individuals to see what the sequelae may be even after recovering from this disease.
Don't we have 3 other coronaviruses that repeat like the flu every year?
The cold is a
rhinovirus.
Common cold.
Regular cold virus.
That's right.
So this is, I didn't realize coronavirus sounded, given what's happening in China, terrible, but there are 3 that repeat, others that repeat every year.
That's right. Yeah, I mean, coronaviruses, it's a family of RNA viruses, and they can cause, mild, viral infections like the common cold, and then more severe infections like MERS, SARS, and now coronavirus disease.
Just very quickly, how close are we to a vaccine, and as and when one is found, does that stop it dead in its track in terms of whether we need to still fear it or not?
So I think we're still at least perhaps a year out from an actual effective vaccine. So certainly I think good old public health measures are going to continue to obviously take center stage. But I think even then, when a vaccine is even available, we've seen this during the measles outbreak, right? The anti-vaxxers. So we may have a vaccine available, but now we're going to have to face another issue of, do people want the vaccine? And are they going to actually be willing to get vaccinated?